Well, it's Thursday, so you know our In Focus Health correspondent Linord Moudou is right here with us in the studio. Today, kicking off the segment with these new guidelines about HIV-positive mothers.
That's right, Dimyaki. The World Health Organization has released new guidelines urging HIV-positive women to receive antiretroviral drugs to protect against transmitting the virus during pregnancy, delivery, and breastfeeding. They say women need to know their HIV status to gain treatment, and their babies need to be tested early. The new recommendations reverse the WHO policy of advising HIV mothers against breastfeeding because the virus can be passed in breast milk. The WHO says breastfeeding is safe if the mother receives HIV medications. In Africa, more and more HIV-positive women who are pregnant are receiving treatment to prevent mother-to-child transmission of the virus. Having children has always been Rebecca Awiti's dream, but little did she expect to have triplets. The single mother lives in Kayole, Kenya.
It's a little bit difficult because there are 3 at a go, but I'm managing it.
The triplets are a lot of work, but Rebecca counts her blessings. She has been living with HIV since 2002.
So I was really interested in having a child because I'd not had one before. Yeah, so I was also thinking, like, in case I just have to die, then it's worth having a child.
During her pregnancy, Rebecca took antiretroviral drugs to prevent HIV transmission. Still, she was nervous. Would her baby be born without the virus?
When I saw negative results, that was after the first 2 weeks, I got happy. When I saw the next one after 6 months, I was happier. So I just concluded within me that I know they'll be HIV negative.
More than 3 years later, Nathalie, Lennox, and Nicole are HIV negative, and Rebecca is now a social worker counseling women with HIV. Preventing mother-to-child transmission of HIV is still the exception in the developing world. In sub-Saharan Africa, only 45% of pregnant women living with HIV receive life-saving antiretroviral drugs. UNAIDS Executive Director Michel Sidibe has made having babies born HIV-free a top priority.
It's not acceptable. We have 400,000 babies born every year in Africa with HIV, when we know in the rest of the world we don't have any more transmission from mother to child.
The head of UNAIDS says the group needs up to $20 billion in the next 3 years to sustain progress in treating African mothers with HIV. Here in the United States, the government recently released a national HIV strategy. Over 1.1 million Americans live with HIV, and President Obama says the strategy is an effort to refocus public attention on ending the domestic HIV pandemic. Joining us is Frank Oldham, President and CEO of the National Association of Persons Living with AIDS. Mr. Oldham, welcome to the program.
Thank you very much.
Let me have your opinion on this new national HIV strategy. What do you think it means in terms of fighting HIV in the United States?
The National AIDS Strategy is an historic development, and we must praise President Obama's leadership. We have never had a National AIDS Strategy in the United States, like many countries in Africa. So this is historic that we have this now. President Obama and his team, Jeff Crowley, Director of National AIDS Policy in the White House, have made a tremendous accomplishment, as has all of our national groups here in Washington.
Now, your organization has just sponsored a forum at the International AIDS Conference in Vienna, a forum about research on vaccine, HIV vaccine. Tell us a little bit about that.
Yes, the forum actually research advances from therapeutic vaccines is a way of saying there are new developments in treating HIV and AIDS. We at NAPWA, the National Association of People with AIDS, which is the oldest AIDS organization in the United States, really want people to know what new therapies are available. We are very fortunate that we live in a time when there are medications that people can live longer, have full lives. We're all very grateful for that. Now the issue is to actually continue those advances, continue those treatments, and save more lives.
What other issues are on the agenda with your organization?
We actually, NAPWA is the founder of National HIV Testing Day, June 27th every year. NAPWA is also the founder of AIDS Watch, where Americans living with HIV and AIDS from all 50 states come to Washington to educate congressmen about their difficulties in attaining medications, difficulties in having AIDS housing available. All these difficulties really prevent people from getting well and having full lives.
Now, let's talk about your personal experience. You've been living with HIV for 20 years. And what has this been like in terms of surviving at a time where there were not so many resources for HIV patients?
Well, I remember in the early 80s, all of my friends, so many friends in Greenwich Village, in Chelsea, and so many gay men, actually, in America died from AIDS, about 250,000. We've had over 500,000 deaths in the United States of America from AIDS. I'm a fortunate person. I've been living with HIV for over 20 years. I'm known as a slow progressor, so I've been fortunate, and I'm still here. I thought I would not be here in the early 80s. It would have shocked me to realize that I'd still be surviving now and have a wonderful position like the leadership of the National Association of People with AIDS.
Now, quickly, in 10 seconds, what are the most important issues now? We know that everybody hopes for a cure, but besides a cure, for someone like you, what is the most pressing needs?
Well, one of the most pressing things is people need to know their HIV status. So we want increased testing in the United States. NAPWA, the founder of National HIV Testing Day, we want increased testing. We want people to know their HIV status, and if they test positive, to get the best quality care.
Okay, thank you so much, Mr. Oldham, for joining us.
Thank you.
And that was Mr. Oldham. Dimiake, back to you.
Well, thank you so much, Linord, for, of course, bringing Mr. Oldham to the viewers' attention and also the issues that you raised. And we look forward to seeing you next Tuesday and Thursday, always with the latest health news right here on In Focus.